Hi, Mr. Nichols. My name is Sarah. I'm going to be your nurse practitioner today. I have to do a head-to-toe assessment on you. How is your general health?
It's okay.
Okay. Is everything going on good in school?
Yep.
Family's well?
Yep.
Okay. Okay. So I'm going to do your first. I'm going to do your blood pressure. Okay, 120/70. Good blood pressure. Then I'm going to take your respirations. I'm going to check your pulse first. .68, very good. Let me see. And now I will do your respirations.
Good.
Okay. Respiration 16, very good. Okay, now you can stop. Ready? Okay, I'm just going to clean my hands and now I'm going to start your physical assessment. Okay, I want to inspect your hands. Next. And check your back. Okay, now you stop. Distribution and your hair texture. Check your scalp. Okay. All right. Good. Stop. Okay. I'm gonna check your face and your sinuses. Your neck. Stop.
Rolling.
Okay, I'm gonna inspect your nose. Check with the light for patency. Okay. Stop. Done.
Yeah.
Okay, now I need you to close your eyes and tell me if this is sharp or dull.
Dull.
Sharp or dull?
Dull. 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 Dull.
Okay. Is this sharp or dull?
Dull.
That's sharp.
That's sharp. 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 Sharp.
Okay, stop. Now I'm gonna check your ears. I'm just gonna look in there, check in there. Take my otoscope and look and check your ears. Now I'm gonna check the outside, the gate panel. Okay. All right. That's good. Stop. Yes, yes. says hearing. Okay. Now hearing, we're gonna do. Okay, it says hearing. Tympanic membrane. Okay, now we're gonna do hearing. Good.
Set, go.
Okay, so now we're gonna check your ears. Now I'm gonna look in your ears with my otoscope. Everything looks good. Now I just need you, I'm gonna check your hearing. Tell me if you could hear this.
Yep. Yep.
Okay, I'm gonna cover one ear and whisper something and tell me what I said.
9. 9.
Mm-hmm.
And I'm gonna check your eyes and your eyelids. And I'm gonna look at your eyes, checking your conjunctiva and your pupils. Look straight ahead. All right. Going to assess your vision, peripheral vision. Can you see it? Okay, can you follow my hand with your eye? Okay. Can you see my finger over here?
Yeah.
Okay.
Yep.
All right, good. Ready? Now I'm going to check your lymph nodes. Okay, everything's good. Ready?
Mhm.
Now I'm going to inspect your trachea. Okay. I'm going to go behind you and check your thyroid glands. Okay. Swallow. All right. Just your neck a little bit. Okay, thyroid's good. Okay, now I'm gonna check your mouth. Open. Your lips are okay. Open. No, not yet. No. Mouth looks good. Lift your tongue. Okay, teeth are good. Stick your tongue out. Ah.
Ah.
Good gag reflex. Okay, stop. Okay, Mr. Nichols, I'm going to examine your cardiac and thoracic areas. Just cleaning my hands. Okay, first I'm going to inspect. Okay, I'm going to inspect the back as well. Okay, looks good. Now I'm going to palpate. Okay, now I'm checking Frenitas. If you want to, can you see 99 every time I move my hands?
99.
Okay.
99. 99. 99.
Okay. Also in the back, lean forward. Kind of put your arms against your shoulders like this, like hug yourself. Okay. All right.
99.
Okay.
99. 99. 99.
Okay. Can you kind of, if you turn this way, turn your body this way, just do one shot. Okay. All Alright, now take a deep breath. Inhale. Exhale. Inhale. Exhale. Okay, now turn around again.
Good.
Okay, I'm just gonna percuss. Okay, lean forward. Or you can turn this way, that way I can get a better view of your back. Okay, sorry for all the turning around. We have to make do with what we have. Just percussing. Listening for the dullness in the lungs. Okay. Good, good, good. Pause.
Good.
Okay, so now I'm going to check your pulses. Pause for a minute. I think I'm just going to check for your pulses. I'm going to check your radial pulse. Nice and strong. Brachial pulse. Nice and strong. Go to the other side. Very good. Okay, pause.
Good.
Okay. So now I'm going to check your femoral pulses. Nice and strong. I'm going to go over to the other side. Nice and strong. Now I'm going to check your pedal pulses. Very good. Very good. I'm going to check your pulses. Good. Oh, very good. And I'm going to check your popliteal pulses. Good. Okay, sounds good.
Good.
I'm going to clean my stethoscope. And I'm just going to listen to your carotid arteries. Good. Good. I'm going to listen to your heart. Okay. Okay, good. Then, ready? All right, and if you just kind of tilt, just pretend you're laying in bed and just tilt a little bit for me so I could listen to your heart. Okay, like kind of. Okay. Okay, good, good.
Good.
Ready? Okay. Deep breath in and out. In through your mouth, all through your mouth. Okay. 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 Okay, now same thing on the back. If you turn this way, then you can catch it in the camera this way. So we can catch it in the
Like
video.
that, facing the camera.
Yeah, facing the camera. Okay. to you. Okay, deep breath in and out. Again. Again. Okay, done. So I'm going to palpate your chest. Ready? Okay, so now I'm going to palpate for any tenderness. Tell me if anything hurts. Okay, and posterior as well. Turn this way, so let's get it on the camera. If anything hurts, you let me know. Okay, good. Ready? Assessment of the breast. So I'll inspect the skin over the breast, noting any abnormalities. I'd inspect the skin for contour, check the contour of the breast for masses, dimpling, or flattening. I'd also inspect the nipples by asking the patient to hold the nipples and the areola by asking the patient to hold the hands over the head. And to inspect for asymmetry, skin dimpling, underlying lesions, and such as cancer. I'd inspect I'd inspect the armpit for rashes, lesions, or discoloration. Okay, stop. Okay, then to palpate the breast, I would ask the patient to hold their hand over the head. I'd have to drape the patient. You know when you're ready. Okay, to inspect the breast, I would inspect one breast at a time, remembering to cover the breast that I'm not working with, to drape the patient. So I'd ask the patient to raise the arm on the side that I'm working, and start by palpating from the axilla region down. I would also I'll palpate in a straight line between in a systematic way using 3 fingers of my hand. I would begin in a lateral from the armpit in a lateral position, working my way down, and from the tail of the axilla, the tail of the breast tissue up to the axilla. I would note for consistency, nodules, and masses. I'll palpate between the bra line and the nipple in the same systematic way. And finally, I'd palpate the nipple and areola. Stop. Okay, and finally, I'd palpate the nipples and areola of the breast, checking for discharge. And then I'd repeat the same sequence on the other breast, remembering to drape the patients on the side that was already examined. Okay, I'm just going to clean my hands, and then I'm going to do an assessment of your abdomen. So first I'm going to inspect your abdomen, looking for symmetry, contour, movement, and scars. Everything looks good. Then I'm going to auscultate for bowel sounds and for your major arteries. Let me check for your abdominal arteries. I'm going to check your femoral pulses, inguinal pulses, sorry. Okay. Now I'm just going to percuss. Stop. Okay, I'm going to percuss. I'm gonna percuss the span of your liver, the spleen. Okay, lean forward. And now I'm going to, okay, stop. Now I'm going to do a light palpation first and then deep palpation. So I'm just going to palpate your abdomen, looking for any pain or any discomfort. It feels okay. Then I'm going to do a little deeper palpation. Okay, now palpate your liver, your spleen. Now, if you roll over a little bit, I can palpate your kidney. Okay, and the other side. Okay, and just your pulses. Okay, that completes your abdomen. Okay, so we're gonna do the musculoskeletal assessment. Okay. Okay, so first I'm going to assess you. Okay. Now take a little open and close. Okay. Now I'm gonna assess your hands. Okay. Assess your hands and your joints of your fingers. Okay. Stop. Ready? And now we're going to check for your range of motion in your arms. Okay, both. Okay. Alright. Now you're going to look down, up, and to the right, and to the left, and to down. The next side. Then bring both arms to the back, touch the back of your neck with both arms, and then to the lower back. Okay, good. Stop. Push your head against my head. Okay, good. And then, okay, I'm gonna check for rotation into both the arms. Okay, good. And the other one. Good. Okay, now can you stand for me? Close your eyes and stretch your hands in front of you. Okay, bend your hands down towards the floor and then up your fingers towards the ceiling. Okay, then take this finger and touch your nose. Bring it out. Take this finger and touch your nose. Bring it out. Okay, now keep your hands, straighten your fingers towards the floor. Okay, and then you can sit down. And open your eyes. Okay, close for a minute. Stop for a minute. Now I'm just going to assess the strength, your muscle strength. So squeeze my hand as hard as you can. Okay, good. Nice and strong. Okay, stop. Okay, now you're going to turn your hands, palms down, up, palms down, up. Okay, good. Very good. Can you touch your fingers with your thumbs, and go as fast as you can? Okay, good. Thank you. Okay, so now I'm going to inspect your knees to make sure everything is okay. Both sides, both knees. Okay, your legs. And so, look at this part, check your. Okay. Then push your toes down and up. check your range of motion of your knees, your legs. Okay. Okay, remember I'm going close in. Ready? Okay, Mr. Nichols, we're going to assess your, doing neurological assessment. So we're going to start with your olfactory, your sense of smell first, okay? So first I'm going to occlude the right nostril and ask you to take a deep breath. Out. Good. Now the left nostril, deep breath. Out. Okay, now I'm going to ask you to close your eyes, and you're going to have to identify these smells for me. Okay. Close with a deep breath. What does that smell like?
Wine.
Good. Keep your eyes closed. Sanitizer. So you're gonna what do you smell?
Hand sanitizer.
Okay. And then the third one. Deep breath.
Coffee.
Very good. Okay. Now I'm gonna cover the other nostril, your left nostril, and have you smell from the right nostril. Okay. What is that?
Well, I can smell the hand.
So
Go,
both. So
go.
one.
Mhm.
Okay. Okay. Now, can you take a deep breath? Do you identify that smell?
Wine.
Okay. Next. Okay. Deep breath, and can you identify that smell?
Hand sanitizer.
Okay. And third, deep breath. What do you smell?
Coffee.
Okay, good. You can open your eyes. All right. Now we're going to check your visual acuity. Can you read this line?
TOZ.
Oh, sorry. Pause.
Go.
With both eyes. Can you read this line?
LPED.
How about this line?
EPEC. FD.
Okay, what about this?
Oh, I can't read that.
Okay. So now we're gonna do your monovision. So we're gonna check each eye. So can you cover the left eye? And can you read this line?
No.
How about this line?
TOZ.
Okay. And what about this line?
No.
Okay. So your right eye. Okay. Stop for a minute.
Okay.
Okay. Can you? What's this letter?
E.
Can you read this line?
FP.
Well, how about this line?
TOZ.
How about the next line?
LPED.
How about this one?
PECFD.
Okay. How about the next
I
one?
cannot.
Okay, so your left eye is 20/40. Okay, you can stop, Charlie.
Action.
Okay, so I'm going to check the fundus of your eyes. So I'm just going to look in with the light, look straight at the light. And I'm going to check your eye. Okay. All right, that's done.
Action.
Okay, now I'm going to check your pupil. Look straight ahead. Open your eyes. Okay. Yes, pupil reactive to light. Okay. All right.
Go.
Okay, ready? Now I'm just going to ask you to follow my fingers with just your eyes. Okay. Okay, good.
Go.
Okay. Now close your eyes, and I'm going to test your sensation to soft, dull, or sharp. So tell me if this is sharp?
No.
What do you mean? I'm poking you. Is this sharp?
Not particularly. Not a lot sharp.
Charlie, stop that.
Yes.
What do you feel?
Sharp. 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 Sharp.
Okay. Is this dull?
Yep.
Good.
Do. 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 Do.
Soft. Is this soft?
Soft. 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 Soft.
Okay.
Go.
Okay, now I just want to inspect your face to make sure it's symmetric. Okay. Okay, good. Stop. Okay. So you're gonna tell me if this tuning fork, if the volume is equal on both sides, okay? If you hear it on both sides. Mm-hmm. Say yes.
Yeah.
Okay, good. Volume.
Go.
Tell me when you no longer hear the ringing.
Okay. Okay.
All right, good.
Go.
Ready?
Go.
Okay, can you open? Let me take you and open. Can you swallow?
Look.
Okay. Gag reflex is good.
Go.
Okay, I'm just gonna ask you to push your head against the resistance. Push on the right side. Now we're gonna check the left. Do the same. Push against resistance. Your face. Move your face. Good. All right. Ready?
Okay, go. Go.
Okay, you're gonna shrug your shoulders against my resistance. Shrug your shoulders again. All right, good. Okay, I'm gonna inspect your mouth. Open up. No, you push left. Put your tongue down. Left. All right, lift your tongue up. Okay, and down. Okay, very good. Ready? Okay, I'm gonna check your reflex, your triceps reflex. I'm gonna use my reflex hammer just to check. Okay, good. Good. Good reflexes.
Go.
Okay, I'm gonna check your biceps. Okay, good. Next side. Good. Good reflex. Brachio.
Go.
What is brachioradialis? Ready? Okay, we're gonna check your brachioradialis reflex. Good. Good. Good reflex. Can you see? Okay. Okay, ready? I'm gonna check your right patella and the left. Okay, good reflexes. Let me know when you're ready.
Ready.
Okay, I'm gonna check your Achilles. Reflex is good. Achilles reflex is good on both bilateral way. Okay, so now we're gonna check your motor reflexes. So I need you to close your eyes, stretch your hands out in front of you, both together, and you take this finger and touch your nose. Stretch it back out. Take this finger and touch your nose. Stretch it back out. Okay, you can open your eyes. Good.
Go.
Okay, now I'm gonna ask you to run your right foot down your left shin. Okay, good. Then run the left foot down the right shin. Very good, very good. Hit
Go.
Alternating your hand alternating movements. Ready? Yeah, hand alternate. I need you to move. Okay, very fast. Okay, very good, very good, very good. Ready?
Go.
I'm just gonna check your gait. So I need you to walk towards the wall. And then turn. Walk back towards me. Okay, and turn. Now I need you to walk on your heels towards the wall. And turn. Now walk on your toes, coming this way. Yes, coming back towards me. All right, very good, very good. We're going to check your sensation. So I need you to close your eyes and tell me what letter I'm writing, tracing on your hands.
O.
Okay, next hand.
O.
Okay, very good.
Go.
Okay, so we're still checking your sensation. I need you to tell me if it's sharp,
Sharp.
Sharp.
Sharp. Sharp. Sharp. Sharp. Sharp.
Now is this dull?
Dull. 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 Dull.
And how about this one? Is it soft?
Soft. 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 Soft.
Okay, good. Then
Okay, let's go. Go.
ready? We're gonna check the sensation in your legs. Is this sharp?
Sharp. 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 Sharp.
Okay. Is this dull?
Dull. 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 Dull.
How about this? Is it soft?
Soft. 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 Soft.
So now I need you to close. Is that my phone? Let me know when you're ready. Okay, tell me when you feel the touch.
I feel it.
Okay, all right, that's good.
Go.
Then I'm gonna test your position senses. I need you to close your eyes and tell me. Stop.
Go.
Okay, I need you to close your eyes and tell me if I'm moving your fingers or when I can move your fingers up or down.
Up. Down. Up.
Okay.
Go.
Okay, now I'm gonna close your eyes and tell me what I put in your hand. Cotton ball.
Cotton ball. Cotton ball.